Thank you, Anna. I just want to do a quick introduction. Hi, everybody. This is Debbie Fox, and I'm with the National Network to End Domestic Violence, and I'm also a part of the DV and Housing Technical Assistance Consortium with our HUD-TA partner Collaborative Solutions, also the National Alliance for Safe Housing, the National Resource Center on Domestic Violence, and the National Sexual Violence Resource Center. We're also joined on this webinar today with one of NNEDV's partner in our collaborative approach to housing for survivors work with the Women of Color Network. And I'm very pleased to welcome you all to our webinar on racial equity in our housing work here today on December 11th, 2019. So on today's webinar, you're going to hear from Zoe Flowers, Director of Survivor Programs with the Women of Color Network, and we're very lucky that she's with us today and leading this conversation with us all. She will also be fielding questions in the chat box during the webinar. There's an opportunity for discussion, and we are hoping that people engage and chat with one another. There'll also probably be time at the end for Q&A at the end of the official PowerPoint portion of the training. And so the goal of the DV and Housing Technical Assistance Consortium is to highlight what bubbles up from the field and share the innovative work that's happening and to share that with you all. And of course, as many of us know, racial equity is integral in our work in housing as communities of color and women of color are particularly disproportionately impacted by discrimination in housing. So we're really excited about this conversation today and looking at ways we can make changes within ourselves and within our programs. So without further ado, I'm going to turn it over to Zoe, and she's going to begin today's webinar. Thank you, Zoe, so much.
Sure. Thank you, Debbie. So hello, everyone. Thank you so much for joining the call today. As Debbie said, I'm Zoe Flowers, and I am the Director of Survivor Programs at the Women of Color Network. And the Women of Color Network, we started as a project, actually, of the Pennsylvania Coalition Against Domestic Violence. And after several years under that organization, we were then a part of the National Resource Center on Domestic Violence. And then we spun off and became our own national grassroots organization. And so once we were not, once we became our own organization, that really allowed us to branch out into a few different areas and talk about different subjects other than domestic and sexual violence. And it also enabled us to really stretch our mission, and our mission really is to promote the leadership and to center the wellness and the voices of women of color across sovereign nations in the U.S. and in the U.S. territories, right? And so the purpose is really to work beyond domestic and sexual assault, as I said, to address a broad range of violence affecting communities of color, such as human trafficking, police brutality, and over-incarceration. And so we do this by examining and responding to a global context of colonialism, imperialism, capitalism, heterosexism, and all of the other isms, right? And other forms of oppression that intersect with violence against women of color in their communities. And so my gender pronouns are she, her, hers. And as I said, my role is the Director of Survivor Programs. And what motivates me to do the work still is coming to the work as a survivor. And that's what motivated me in the beginning. And now my role really is to help folks doing the work to center their own healing, right? So my motivation has shifted over the years. So as Debbie said, I want this to be as interactive as possible. So if you all feel like you want to just put your name, your gender pronoun, if you like, and what motivates you to do the work, you can put that in the chat. So again, your name, your gender pronoun, and what motivates you to stay in the work. So I'll give folks a few minutes to do that. And if you want to remain anonymous in your answer, you can also just put your gender pronoun and what motivates you. Completely up to you. Okay. So looking at the big picture of this conversation, the discussion is going to foster a commitment and action plan for ongoing race equity work. We're also going to talk about the biases and its impact on our work and organizations and explore ways to interrupt and create cultures of inclusion and authenticity. We're also going to explore how connections inform prevention strategies and refine state strategies through a racial equity lens. So this conversation that we're going to have is really the culmination of a couple of different projects that I worked on. So one was the racial equity project, and then one has to do with our expanding our lens, expanding the way we look at the work, and then the other is a result of listening sessions about racial equity that I did around the country with advocates and state and domestic violence coalition directors. So how we speak, see, and disrupt racial inequity. So I wanted to invite you all to think about what was the last racial equity conversation you had, and when and where did it occur? And when you hear racial equity, what comes to mind? So I'm going to ask you to put those answers in the chat. For some reason, I can't see the chat. Deb or Anna, I'm not sure if that's intentional, but it says multiple attendees are typing, but I just can't see the information in the chat. Oh, you can see it. Okay, amazing. Okay. So will you all tell me what some of the answers were about the last racial equity conversation?
A couple of things, Zoe, I can chime in. I don't know if you can see the chat box yet.
I can't. Yeah.
You can click. You can X the room really quickly, and it should show. I'm not sure exactly. No, Anna, if you can give more specific directions, but I can chime in a little bit of what people are talking about. Is that there's conversations around people of color in positions of decision making and improving opportunities for people who wouldn't get their voices heard or be made a priority. Another person's last discussion within the last week, and then talking about what comes to mind when you're undoing privilege and creating equality, opportunity, rights for all. Another person had discussed issues around mandated reporting and neglect, and what are the roles for DV advocates, and what are the equity issues around that. And then someone was at a community meeting where they were talking about racial equity, and they think of communities that value and uplifts the voices of people of color. Let's see, there's so many good ones that are just now coming in.
Okay.
And redistributing resources across counties and making what is the difference between equality and equity. So those are a few examples.
Okay, great, great, great. And I saw someone said to, thank you, Anna, for putting some of these in the chat so I can see them. That the person that said it's more than just a discussion, right? It actually has to do with action. So that's really exciting. And Then the next question I'm going to ask you all is, what was the last racial equity and housing conversation you had? When and where did it occur? So if you all will put that in the chat, that would be great too.
Okay, Zoe, if you would like, you can exit the room and then enter again. And then we have a couple participants that are still typing, so if you'd like to try that out and then join us again. And
Fantastic. I'm going to do that right now.
Okay.
Great. Great. So I am back. I can see everyone in the chat. That is so great. So Danny Ball says, I was just talking with my supervisor about this today. We were discussing the book Evicted, and this is about housing issues for people of color. And then someone was talking about it last week. Someone hasn't really discussed it yet, but they will when they have a new housing coordinator next week. Wow, great. So this conversation is coming at a great time. So I'm sure that you all know about the predictors across race, but I did want to share this, this graphic with you all. I like to show this quite often because one of the things it shows, obviously, are the varying factors across race. And so whereas the amount of income looks at as a large predictor of race when it comes to white and Hispanic folks, but when it comes to Black folks, it is about employment. And so one of the things we know is that women of color experience higher rates of domestic violence and sexual assault than their white counterparts, and that people of color living in poverty at a rate of 27 versus 10% disproportionate to whites. And so when we think about this conversation about housing, and we're making all these linkages, so obviously you're living in a lower poverty, in a lower poverty percentile, more than likely you're going to be in a lower income neighborhood, and then, you're already a person of color, and then you start thinking about the type of housing choices that are available to you and who is willing to rent to you. What if you have more than one child? How is that going to impact your ability to have good housing, right? And then we know that poverty has a compounding and reciprocal effect on violence. Here, this recent multi-city study by the Center for Social Innovation found that families and communities of color are not prioritized at the same rates as white single folks, as BIPOC individuals and families experience system-level inequities in housing, resources, prioritization in homeless systems. And so when we talk about racial disparities in intimate partner violence, we find that the economic barriers facing survivors of color are primarily place-based and race-based. And systemic barriers faced by survivors are based on race and poverty, which I'm sure is no surprise to anyone on this call. Oh, hey, Jean, it's hard to hear. Let me turn up my phone is actually as high as it can go, but I will hold it, and maybe that'll be better. You all let me know in the chat. Oh, you turned it up on my, okay, great, fantastic. Still talking about racial disparities, one of the things we know is that 4 out of every 10 American Indian or Alaska Native women, 46%, and 1 in 2 multiracial non-Hispanic women will experience violence in their lifetime. And more than 1/3 of Hispanic women and about 1/5 of Asian or Pacific Islander women in the U.S. will experience domestic and sexual assault on their end in their lifetime. And according to a 2017 report, black women were 2.5 times more likely to be murdered by men than their white counterparts, and more than 90% knew their killers. So one of the things that I like to talk about is this idea about converging identities, right? And so these arrows are pointing to the Muslim woman in the center. And this person, she could be experiencing any one of these things at a given time, right? She could be experiencing ageism. She could be experiencing racism because she's an immigrant refugee. She could be LGBTQ, so she could be experiencing homophobia. She could be experiencing religious discrimination. Any one of these things can be occurring at one time when they come to us, right? And so put simply, according to an intersectionality perspective, inequities are never the result of a single distinct factor. Rather, they are the outcome of intersections of different social locations, power relations, and experiences. And so for those of you all that are not familiar with intersectionality, it is a feminist theory, it's a methodology for research, and it's a springboard for social justice action agenda. And what it does is it aims to address the manner in which racism, patriarchy, class oppression, and other systems of discrimination create inequalities that structure the relative positions of women. And so we have a slide, here with a video for Kimberly Crenshaw, and she's actually talking about intersectionality. And Anna, I think you said you were going to put that in the chat for me so that folks will have access to the video. She does a great job of talking about intersectionality within the realms of classrooms and schools, colleges, universities, high schools, junior high schools, and she's really talking about the intersection of African American girls being pushed out of school and how that is a race issue, but it's also a gendered issue. So it is an amazing, short video, and even though she's talking about education, it also links back to our work. So I wanted to talk about primary prevention here, and just as we think about our different strategies that we may be employing for housing, I want us to look at it through a prevention lens. So folks that know about prevention know that we call these CABs, and CABs are knowledge, attitudes, beliefs, and behaviors. And so these are the things that we're really working to change. So for change in knowledge, we need to provide succinct and clear information, right? Knowledge change can occur in a one-time brief up to 1 hour encounter. And then we have attitudes. And so for attitudes to change, we need to provide information and appeal to the emotions or personal impact, right? So we're making an appeal to emotions. We're talking about personal impact, right? And so this takes some practice. It takes several times and multiple encounters in order to change attitudes. And then when we talk about beliefs and behaviors, these are usually the hardest to change, right? So for a change in behavior, people need to demonstrate and practice new skills and communicate with others during the learning process. Usually this takes multiple events that include practicing the skills over and over and over again, because again, these are the ones that are the hardest to change. But this is what we're working towards when we're doing prevention, right? And so prevention really exists on a continuum. So we have actual what we call primary prevention, and that occurs before the violence ever happens, right? So before the violence ever occurs, that is what we call primary prevention. And so in primary prevention, what we're doing is we're focusing on the conditions that support intimate partner violence. We're focusing on promoting conditions that inhibit intimate partner violence and promote behaviors that you want other people to adopt, right? And then we have our secondary and our tertiary prevention, which is on the other end of the prevention continuum. And those are usually our responses, right? Our responses to intimate partner violence and different practices we do to recognize intimate partner violence. And so a simple vision, right, would be creating a dating violence program in our high schools and thinking that that's all that's needed to prevent intimate partner violence in our entire community. That would assume that knowledge and a short-term intervention in one setting is all that's needed. A more complex vision is that adolescents are influenced just like us, just like adults, right? We're influenced by many different factors that support or condone intimate partner violence. And so any one of these factors needs to be addressed in a consistent, systemic manner. Because again, we're not just changing knowledge, we want to change attitudes, we want to change beliefs, and we want to change behaviors, especially when it comes to housing. Because we kind of already said in the beginning of this conversation, we know that poverty significantly impacts communities of color. So we want to change the attitudes and the beliefs and the behaviors of the people that are coming into contact with them, right? So because of this, we look to the social ecological model. So disclosure also on my end, I was a Delta coordinator when I worked for the California Partnership to End Domestic Violence. And the Delta Project was a primary prevention project from the CDC. And so what we did was we came up with all different prevention strategies for our local domestic violence, our local Delta coordinators, right? So we had the coalition level, we were the leads, and then we had several local coordinators across the state that we worked with. So a lot of this conversation is coming from that background, right? I just want to give you some context for this. So we worked a lot with the social ecological model when we were working with local domestic violence programs, because one of the things that we believed was that we had to work at multiple levels. We had to work at the societal level, we had to work at the community level, we had to work at the relationship level, and we had to work at the individual level, right? If we were going to create successful prevention strategies. So each level of the social ecological model can be thought of as an avenue through which individual behavior, development, change, and maintenance can be promoted. So when you're thinking about prevention strategies or when you're thinking about any programming that you all are taking part in, it looks like we've got 99 people on the call right now, which is amazing. When we're thinking about our programming, we want to filter it through a racial equity lens, of course. We also want to be thinking about prevention strategies that we can create across the levels. And so the key is to know which avenue is going to be used to influence individual behavior. And if you have any questions about any of that, please just put it in the chat. So CDC's prevention framework works across the individual, the relationship, the community, and the societal level. So if we're talking about before the violence happens, we had, and they're still pretty popular across the country, Men of Strength clubs. Some people call them MOST clubs in their organizations, and they gathered young men to talk about masculinity and things like that. And then on the relationship level, there are campus dialogues that are happening with men on the college campuses. And then on the community level, you have social norm campaigns, right, that you see around your states. Back when I was doing this project, some of our local coordinators would have relationships with local movie theaters, and so you would see campaigns about intimate partner violence prevention in between the movies. And then on the societal level, that's when we're talking about legislation that promotes the status of women, right? So those are all the things that are happening. And we started this work back in 2005-ish. And so this was all the work that we were doing at that time around the country. And then after the violence occurs, obviously you have your arrest and your crisis services, you have your protective orders at the relationship level, you have police protocols or Take Back the Night rallies that really worked on that community level, and then you had, again, legislation and defining violence against women as a crime. And again, that is after the violence occurs. And so what we're doing is we're focusing on what we're trying to change, not where we're trying to implement change. And if anyone has any questions about that, please feel free to put it in the chat. So I like to use the social ecological model because I do believe that it's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment really do conspire against such change. And again, we started doing the work, I want to say again, back in around 2003 or so. And so obviously Facebook I think came a couple years after that. So when we had this conversation, we weren't even under the influence of social media that we are now, right? And so if this was true way back in 2003, you know it's even more so true now in 2019, right? We are inundated with information all the time. And so an example of a comprehensive approach would be having individual level curriculums, counseling, and mentoring, right? Because what you're doing on the individual level is you're really working with that person and increasing their knowledge, attitude, beliefs, and behaviors. And then on the relationship level, that's when you see your support programs, your mentoring, your parent trainings. And so what you're doing is you're changing the information from the relationship from one person to another. So if this was for a student, again, the individual level would be a counselor or mentoring. If it was on the relationship level, you would be doing parenting trainings because you want to obviously have the parents learning the same things that the young people are learning. And then community. You want to change the environment that young person is actually in every day, right? So you might be doing community education, or you might be working on policy change. So again, for those of us on the call, think about what we can do on that community level around housing to change those circumstances, right? Making sure that the housing that folks have is safe. And then on the societal level, that's really when you want to change society's view as a whole. So you're going to be doing media campaigns, and again, you're going to be doing policy change, right? So that's what a comprehensive approach to this work would look like. So the three-tier approach, sometimes we call it a model, sometimes we call it a lens. And it was created by our executive director, Tanya Lovelace, our CEO, when she was asked to write an article for Stop Administrators about underserved populations. And one of the things that she argued was that the underserved are not just one thing. So they're not a monolithic group, right? So many of the ways our language is, it's like the underserved. You know, I'm working with the underserved. But who are these folks? And so through this lens, through this approach, through this model, it has allowed us to work with folks all across the country and in the territories to really expand the way they look at the folks that are coming in their doors, the folks that they're serving, and also helps them to have a more expanded view of how they are writing requests for proposals or the programming that they do. So first we have the unserved, right? And unserved are people who truly have no services available to them, and they face severe isolation. I thought someone was typing something in the chat, and it stopped. So if you want to retype that, if you have a question, you want me to repeat something, I will wait a second for you to retype it in the chat. Okay, I'll hop back in. But if you do have something, you want me to slow down, you want me to repeat something, I'm happy to do that. So, back to the unserved. So they are folks who truly do not have any services available to them, and they are facing severe isolation. They could be, okay, thank you, Lisa. They could be unserved because of a geographic location. They could be unserved because of their age or their gender. So I want you all to think about in your communities who the unserved would be. And if you have or you want to share, yes, absolutely. Deaf population is one of lack services available to them. Absolutely. Rural victims, yep, absolutely. And so this training is typically, we've done this training over a day and a half, just this section. Deaf population, rural victims, LGBTQ2S+, yep, rural, people of color, refugee populations, those with physical disabilities, absolutely. Male victims, absolutely. And then we have the underserved. And the underserved are folks that have minimal or limited access, and they are in need of more outreach and support. So these are moderate folks experiencing moderate isolation, right? So if you all want to enter that in the chat, who might be underserved? Are there what folks are calling emerging populations in your states, in your towns? There is a deaf, blind living at hotel and hearing group home. Think the deaf is safer at a hotel. Wow. But the deaf person is isolated. Absolutely, absolutely. Absolutely. Permanent residence. I mean, I know what you meant. T and U visa applicants. Absolutely, yeah. And I'm going to go on to the next one while you all enter that information in. And then we have our inadequately served populations. And so these are folks that are historically marginalized, and they may be overrepresented in our programs, in the criminal justice system, in our health and human services systems, right? And so those are folks that are inadequately served. Transgender folks, intersex folks, recent immigrants, deeply poverty and literally isolated communities. Yes, I'm thinking that you mean that for underserved. And so now thinking about folks that are inadequately served. That's okay, Charlie. Thank you. Folks that are inadequately served. So who are those folks in your community? Right? And why we say that these folks are inadequately served is because of the fact that they're continuously coming back, right? We're continuing to see those populations in our services. And so what that tells us is the services that we are providing are inadequate to meet their needs, right? And so we have unserved, underserved, and inadequately served, right? Indigenous members of unrecognized tribes. So, as I said, this is usually a long presentation where we have an actual, we use this as a handout, and we have this list, and then we ask you all to think about who might be unserved, underserved, and inadequately served, right? And so, again, unserved are people that have no services. They face severe isolation. Underserved are folks that have limited access and moderate isolation. Inadequately, folks are overrepresented, and they have access, but the quality is limited. So if you were all to think about in your communities where folks might fall, I'd love to have you put that in the chat, but I'm going to layer it a little bit, right? So for LEP, which is Limited English Proficiency, if you all think about your programs that you work in, right, or if you're a state agency, think about your state. And if you had a person who was limited English proficiency that also had a cognitive disability and they were undocumented, would they be unserved or underserved in your community currently or in your program? Underserved, underserved, underserved. Inadequately served. Mm-hmm. Death including severe disabilities. Underserved or unserved. Mm-hmm. Unserved. And so again, unserved. Mm-hmm. Actually, I'm going to say unserved. Yeah, I would have you really think about that, right? How many of our programs are really set up to handle the converging identities that we talked about before, right? Limited English proficiency, undocumented, cognitive disability. Where would they really fall right now, today, right? So just thinking about that. And so if we were together in an actual presentation, we would break it down even more by county and all of that. But this is, again, just to get you all thinking, if you haven't already, about sort of the expansiveness that people come with and the way our services are currently set up to handle folks. And that's right, the more elements that come into play, the more unserved they become, absolutely. And when I talk about our listening sessions that we did, which I'm going to do in a minute, that will become even clear. Yes, thank you, Lisa. I should have said that. API is Asian Pacific Islander. LEP is Limited English Proficiency. LGBTQI is lesbian, gay, bisexual, transgender, queer, and intersex. Okay? The intersections would make services from one anti-violence agency inadequate, would need access to multiple specialized agencies to get needs met. Absolutely. Absolutely. And one of the things I say is that our services they just have not caught up to yet the way our society keeps changing. In the same way that social media changed so much just since I was doing this work in 2003. So has the landscape and the people that are coming to our doors now, right? So we just really haven't caught up yet. And so we wanted to get a bigger idea about what was happening, not just with unserved, underserved, and inadequately served as WOCN. We also wanted to know about what was happening in the field with women of color, with women of color who are survivors of domestic and sexual violence. We wanted to know what was happening around racial equity, right? And so we got involved with the REAP project, And it really seeks to increase the capacity of the field to address racial and other structural and institutional biases that pose barriers to economic stability for survivors of domestic and sexual violence, right? So we've already sort of given ourselves, just from this exercise, we've shared with each other kind of what's happening in our states, where folks are falling, whether they're unserved, underserved, or adequately served, right? We already have figured that out. So these could be potentially the people that are coming through our doors, right? All these folks, these folks that are underserved, these folks that are inadequately served. And my guess would be if they're underserved in our movement, they're probably underserved in education. They're probably underserved in healthcare. They're right across the board. They're probably underserved and inadequately served, right? So those are the folks that are coming to us, right? And so now what I'm going to lay out for you is the environment that folks are coming into when they come into our shelters, when they come into contact with us, right? So we already know that they're dealing with issues of poverty. We know they're dealing with housing issues. They've experienced violence, and now here they come to us. And these are some of the things that folks experience from the advocate's perspective of what's going on in shelter. Okay, so these were the partners on the REAP project. The Southwest Center for Law and Policy, the Asian Pacific Institute on Gender-Based Violence, Casa de Esperanza, the Texas Council on Family Violence, Kirwan Institute for the Study of Race and Ethnicity, Camille Holmes, and Bill Kennedy. So the listening sessions and the report, right? So I was the person who did the listening sessions with advocates of color who also identify as survivors. I also did the calls with economic justice or policy staff from state and tribal coalitions who are people of color or aspiring allies, right? So as I said, I basically talked to folks working at shelters, I talked to executive directors, I talked to state domestic violence executive directors, and I talked to state domestic and sexual violence staff, okay, 2 years ago. And so what we wanted to do was have a conversation across the field about the ways that racial inequity shows up for survivors in their work, and to inform advocacy and systems change that enhances racial and economic equity for domestic and sexual violence survivors. And so, what we wanted to know is we wanted to know about people's beliefs, because as we said in the beginning, the beliefs are the hardest things to change, right? We wanted to hear about people's experiences. What is it like for folks of color doing this work? And we wanted to know about the comfort, right, that people had with thinking and talking about racial equity and what came to mind. We also wanted to know more about the interplay and difference of racial and economic inequality, the look and the feel of it, right? And we wanted to know what those disparities looked like for the communities that programs were serving. We also wanted to know about economic barriers that survivors were having and how did those things change by race. Right? We wanted to know how organizations address disparities across racial, ethnic, gender expression, ability, immigrant status, etc., and how folks were taking them into account. We wanted to know what partnerships they thought were important, how to build them, and why. We wanted to know where survivors of color were finding the most support in their agency or program, how they were working with other organizations and in what ways, and we wanted to get examples of system change that has had positive impacts on the disparities that we discussed earlier, right? And then we also wanted to know what did they personally need to do this work, because we do all of these assessments and we find out where all of the drop downs are, but then we don't always ask folks who are working within the organization, within the agency, what do you all need to be effective? And so the report that we came up with was showing up how we see, speak, and respond to racial inequality facing survivors of domestic and sexual violence. And there will be a link to that in this in the slides. So here are some of the key themes that we heard. One person said I've always known its presence, but I'm really feeling the weight of white supremacy in many ways right now. I'm really struggling with being within a primarily white-led organization, working with sexual assault survivors, and trying to contemplate how we fundamentally restructure our practice to center folks of color, queer folks of color, survivors of color. And that was a female-identified attorney of color. So one of the things that I had left out was that myself and my colleague interviewed the advocate and survivors, and then another couple of my colleagues, they interviewed attorneys as part of the project. So one of the folks that I spoke with said, I'm a gay male and Hispanic, so even though I am part of a Hispanic community, I still have male privilege to check. In my community, I have white privilege that I need to check. There are all these things I have to learn around that because we all have isms that we have to check. So some of the graphics from the actual report. So when we ask the question about racial inequity, we ask, how have you practiced both self-examination and self-care when it comes to racism and racial bias work? And we heard a range of things, right? So one person said, being an immigrant, I get upset about the mistreatment of survivors because people don't understand their culture. I feel we shortchange survivors because of these biases. It just blows my mind. Okay, if this person doesn't communicate, you can't make them sit in a corner because you can't talk to them. We need a solution. This is not fair. Who are we actually servicing? We're servicing white, middle-aged, middle-class women, and that's great. I'm glad they're getting services, but you know there's more. So that was something that an immigrant survivor said to me. One of the things that an advocate who also identifies as a survivor said, when I talk with survivors, I affirm how systems don't help in the ways they should and the ways that people need. So, for example, we have a lot of calls from people needing housing and getting legal support and all the intersections of race, mental health, economic stability come into play. So remember, before we started this conversation talking about converging identities and intersectionality, right? We see how it comes full circle when they're talking about how hard it is. I have them focus on the fact that these are systems that were not designed with them in mind, and we are not shy about saying that. So that is one thing that advocates said about how they're talking about the work. So internally, a white attorney told us, I am a white person, and it is sometimes very uncomfortable for me to talk about racial inequity because I don't feel like I really can. I can see these things happening, and I want to fix them, and I want to address them, but I don't know how. It's uncomfortable to me, I guess. And so that was something that we heard quite a bit in our conversations. Some folks talked about the fact that they cannot even have the conversation about racial inequity in their work because, number one, we had African-American women that told us they did not want to be looked at as the angry black person, and so they just didn't say anything. And then we had white folks that, again, told us that it made them feel uncomfortable, and so they don't talk about it, right? So we have a range of issues, right? So we have folks talking about how hard it is for them, how they're acknowledging the weight of white supremacy. And then when it comes to working with survivors, you know, we have some folks that are just telling them how it is, right? The systems weren't set up with you in mind. This is kind of how it goes. And then how it's showing up in the, you know, in the work, again, is people need to be cognizant about who they're servicing and what they're offering. And then with advocates of color, they told us that the only thing they could do was be real, be present, and really have people see them and respect their expertise, right? And then in the domestic violence movement as a whole, folks said they wanted to state clearly what racial equity requires and make the necessary changes, and they want the movement to be willing to release or share power, right? Those were some of the things that folks told us. So if you all have any immediate questions that are coming up for you with anything that I've shared, I'm happy to, excuse me, give a moment for you all to put that in the chat. And as you're doing that, Charlie, I want to hop into this conversation about the cumulative harm of racial bias, right? I want to dive into this. So participants from all of our listening sessions highlighted the disturbing yet common ways that racial bias shows up for survivors and advocates of color. Many called for ways to measure and gather data or evidence of the harm consistently reported by survivors and advocates, harm resulting by virtue of their race, ethnicity, citizenship status, religion, gender identity, sexual orientation, and or ability, right? Some participants wanted new skills and tools to help identify, examine, and talk about disparities. So again, right, you know, I was just talking about this last week when I was training, when I came into the work 19 years ago now. We definitely, for me, I felt at my coalition, we were brought into a pretty heavy and thorough communication, right? There were lots of books for us to read. I mean, we studied, we had conversations about race, inequity, all of these things. But there has been a shift, and folks aren't getting that information. Folks are coming into the work, and they're not getting the same information. And so we want people to make changes, but as a movement, we have not really jumped in and made it a requirement to have these kind of conversations, right? So what I'm going to share with you are a couple of narratives that highlight how racial bias permeates multiple aspects of survivors' lives, right? So what shows up? So from a staff perspective, let me go to this next slide. So in the actual, when you download the report, you'll see the way we have it broken down. So one thing says what shows up. So from a staff or program perspective, a woman of color with one small child, constant stream of complaints. She's always breaking curfew, right? That's from the staff's perspective, right? So here's this woman, you know, there's a constant stream of complaints, she's always breaking curfew, etc. What the reality of the situation was the transitional housing program staff knew that she was breaking curfew because she was relying on a cousin to get to work at 10 p.m. at night to give her some of his tips each day until she got started on her new job, right? So basically she was waiting on her money till 10 o'clock at night so that, you know, her cousin could give her some money until she started at her job. And the transitional housing program knew that. They knew she was breaking curfew. She was also waiting on school to start because she needed the school as daycare. Shelter staff were complaining, even though they never attempted to have the conversation with her. And these are the types of things we hear that happen all the time in shelter. And so what might be at play, the staff assumption or unconscious bias, was an over-reliance on assumptions based on stereotypes or media images of angry black women, them being lazy, them being stereotypical, rather than inquiring to the specific survivor about what was going on with her. And then also we have staff knowledge and skills capacity. The advocacy approach relies on service delivery rather than assessing survivors' holistic needs. Staff lack resources and support to assess and address the survivors' multitude of needs, right? And then we have under program coordination, the transitional housing and the shelter staff were not communicating or coordinating cases. So that was another drop down that happened. And then the economic and social reality was the historical systemic discrimination, redlining, segregation results in less wealth accumulated in family networks and communities of color. Thus, social networks or families are unable to offer as much financial or material support to survivors of color, right? And then existing policies, meaning the folks said to us, these were things that probably could have helped this situation. And this was a real-life situation that the advocate shared with us. And what she said was that what we needed were resources to provide income streams to women facing violence, but those are not a high priority, right? And then we have a third column all about considerations and strategies. So I definitely suggest that you go and check out the report because it's really, really quite good. So I want to go to the next slide because this talks about how racial inequity shows up at work, right? So we just talked about how it shows up for survivors, but now we're going to talk about what advocates say about their actual work environments, right? So we asked, how do you and your organization show up to address racial inequity for survivors and staff of color? So one person told us we need to do inward and outward work for equity, said one listening session participant. While some participants shared steps their organizations have taken on the path toward racial equity, others hadn't thought much about the connection between racial equity and the issues in their organizations. Some were frustrated or felt stuck in the status quo, and still others felt unsafe and oppressed in their organizations. As another participant called these stages of engagement, or a continuum of ways that individuals and organizations engage in racial equity. So what we wanted to do was we wanted to map out 4 stages of engagement that individuals and organizations engage in when it comes to racial equity, right? So we have one that talks about leadership and organizational policies, one that talks about the staff of color and how they feel, what their experiences were. We talked with the white staff, and we got their beliefs and actions, and then the programs that they have, right? And I'm just going to read a few from here as well. Okay, so what organizations look like when it comes to leadership and organizational policies? Overall, folks told us that there were little to no racial/gender representation on staff or on the board. There were no people of color in positions of leadership, no policies on racial or gender equity developed, and if there were, they were outdated. So, little to no racial or gender representation on staff or board, no people of color on staff or board, no people of color in positions of leadership, no policies on racial or gender equity developed, or if they were developed, they were outdated. A couple slides ago, we listed how many people were unserved, underserved, and inadequately served. So I would just offer that if we are in organizations that have no folks of color on staff, no folks of color in positions of leadership, no policies of racial or gender equity, and if there are policies, they're outdated, how are we serving everyone? We say we serve everyone, right? But how can we? So an overwhelming staff of color, what they told us, they saw their work as co-opted or ignored by white leadership. They felt unsafe and or isolated, lots of burnout and turnover. They're expected to work in culturally expected performative ways. They were discouraged from offering the same intensive advocacy to survivors of color than to whites of color, right? White staff told us that they believe that they treat all people equally and emphasize that in their work. They focus on perpetrator acts of violence as independent from other oppressions. They value advocates who have degrees, who are not survivors themselves and rely on clinical approaches, and got defensive or expressed discomfort with talking about race, racism, inclusion, or equity. And then what all the folks told us about their programs, right? So this is the rainbow of people, told us that they saw few survivors of color despite the community makeup. Survivors of color are not given the same access and the same resources as white women. They're more impacted by rigid rules. They're exited from programs more often. Cultural competency and self-care are talked about but not practiced. That was across the board. So that's a lot to take in at the end of the day, right? I definitely want to open it up for more conversation, but I do want to just give a couple of more about what folks told us about sort of their ideas that they had. Because overall, folks said they experienced discomfort and pushback, or it was just the norm. So one advocate told us, if I have someone on my caseload who is white and I advocate for them to have extended time in the program, it is easily agreed upon. However, if it's a person of color, I'm asking for them to get extended time, I get pushback. That feels very uncomfortable. So one suggestion that the person had was to do a study or for folks to understand community history and context, and to examine the outcomes of advocacy or legal cases. So that was something that folks wanted the field to do, is to really educate itself better, right? And then other folks felt like this was just the norm. One woman said, I'm an African-American advocate in a majority white area. I think a lot of the reason that staff do not talk about bias is because we get used to it. So it is a norm, and you look over it. I work with African-American clients, while white clients, Hispanic, etc. I mean, I work with all types of people, and it's just the norm. Therefore, you don't talk about the bias or even notice it, really. Right? So what did they tell us about solutions? So in our last section, we asked where you would place yourself and your organization along the stages of engagement in racial equity, right? And so this section offered strategies that each listening session affinity group identified: advocates of color who also identified as survivors, aspiring allies and attorneys of color, sitting, working in unique contexts, and coalition economic justice or policy staff who identified as aspiring allies or people of color, right? So these strategies were directed at themselves to continue learning and advancing racial equity, and as well for others in the field. So these were some of the folks, what they said. What they said they needed: to be heard. I need to be heard. I need to learn from others who are enhancing racial equity well. I need access to information and training. I need service and policy changes that center the margins, i.e. housing, immigration, protection, restorative justice. I need to be engaged in communities of practice with those doing similar work. I need advocates, activities and programs that center and lift up survivors and advocates of color. I need to illuminate and address racial disparities by centering the margins in program priorities and building policy agendas. I need to create safe spaces for advocates of color to share, for professional development, mentorship, and to lead. I need transparent and open opportunities for white and aspiring allies to learn. And then the wisdom that they could offer, right? Because we also asked them, what are you willing to offer to this conversation? And so what they said was, do your own work. Do the inward and outward work for equity. Build partnerships with grassroots organizations and across sectors and movements. share resources, and constantly critique programs. Understand the history and current reality of communities you work with. What's their story? Be bold with programs, with funder relations, with partnerships. And then when they talked about innovative practices, so thinking back again to that prevention work, even around racial equity in our own organization, right? Folks said fostering conversations across programs, staff partners with elders and other programs. Work with partners and advocates to make legal services more accessible and holistic. Prioritize marginalized communities in organizational budgets and hiring practices. Audit organizational practices through a racial equity lens. The other thing folks said they needed was they needed avenues for conversations with survivors, colleagues, and staff to acknowledge racial bias and the difficulty navigating systems, right? And then the innovations that folks suggested, to what extent and who at every level of an organization is carving out space to allow that wisdom that is generated from partnerships to really infuse the organization, right? So that was a question that folks had. So when we were doing the prevention work, this comes out of a training that we did last year in Kansas. We took this racial equity conversation to Kansas. We worked with the Kansas Coalition Against Domestic Violence. And we had them, it was a prevention conference, so we had them take out their state plan, their prevention state plan, and we asked them several questions. And so I wanted to share these questions with you all in case you have reports that you're doing or as you're thinking about your grants that you're doing or any, program creations or anything like that, to just run it through this racial lens, right? So when you're thinking about the goal, when you're thinking about the strategy, asking yourself, how might this goal or strategy have disparate impact along lines of race, citizenship, status, language, class, gender, sexual orientation, ability, access, or power? So when I think about this question, I think about two things. One, I think about the argument back in the day, when the field started to turn in a more criminal justice response. And the advocates of color and the poor white women in the movement, they knew this was not going to be a good idea for their communities. And that is what caused sort of a rift in our work, where poor white women, indigenous folks, folks of different ethnic groups, they really branched off from the mainstream domestic violence movement because they knew that aligning with the criminal justice system was going to have a disparate impact on their communities. And we know that to be true because when we think about the number of women of color that are arrested for fighting back or for whatever when it comes to domestic violence, we know that women of color and poor women are convicted more, face more time, et cetera, right? So really thinking about this great intention, but then really looking at the impact that that strategy could have on folks. And just by given what we heard in the listening session, we know that most people working in mainstream organizations are not often of the same race, citizenship status, language, class, or as the folks that they're serving. They told us that in the listening session. So there is going to be a greater propensity of whatever programs, policies that you're creating of having disparate impacts on communities if the folks that are putting these programs together are not from that community, right? Number two, how might you change the goals to either mitigate that disparate impact or to make racial equity and inclusion an intentional feature? And then the third question, what would this goal look like if you were to frame it through a racial equity lens, right? So even looking at organizations, like what's going on with Uber right now. If they had a thought, if they had had a racial or gendered lens, might they have been able to predict the issues that they are dealing with now? If someone at that table might have said, hey, maybe we need stronger background checks, or maybe we need X, Y, and Z, whatever those crucial questions were, we know that those questions were not asked at the inception of the project or the program or the organization. We know that by what's happening now, right? So if you have any questions, any comments about that, critiques about my argument, please put it in the chat, right? So then thinking about where and how can you commit to racial equity? So again, this is something where if we were together, right, we would maybe break down some of your key strategies that you were planning, and then we would run it through this racial equity lens, right? How might you change the goals? What would this goal look like? We would do that whole exercise. And then we would do some sort of group collective agreement about where and how you can commit to racial equity, right? So if you haven't already, just thinking about what you might do personally, what internal action you might take, right? What one internal action that your organization could do, one external action that you could do, or one external action that your organization could do, right? And then in order to do that, in order to make that shift, what kind of change would what kind of support would you need? So before I go into the resources, I want to go back to this, and I am just inviting you to think about any project that you're working on right now, thinking about, is it having disparate impact, or any work around housing that you're thinking about doing, any goals, thinking about whether or not they're going to have disparate impacts on the communities you want to serve. Just take a few moments to think about that, and think about what would the goal look like if you were to frame it. Here we go. I got kicked off for a second. Looks like folks are coming back on though. Great. So I want to open it up for questions, for comments about anything that you heard. We've got a little bit more than 15 minutes. Debbie, I don't know if you wanted to add anything about housing or anything that we talked about.
I've just been really appreciating the conversation and the very active public chat dialogue, and I don't have anything specific to add, but I just do like the kind of wrapping up framing of it is like we think as we move forward with our housing work in the coming year, and this is the start of a new decade in a new year, that I think that framing it is just like how can we commit or recommit to centering racial equity in our housing work, and then thinking like you were describing, like having kind of the checklist and kind of like the thought processes of like how are we when we're making decisions, and we have a lot more power than we all think of in terms of funding oftentimes, and distributing resources, and like making sure that those communities and the survivors that we serve that are often don't have access or are overrepresented in systems, like how are we centering the work. So I just think that's a great way of framing it, and then like recommitting to that work with each other in the field, and in particular in the housing sector.
Right, right. And it makes me think about, too, with the prevention conversation that we had earlier, what could we do differently in our strategies to have a more focused prevention and racial equity lens? Like, what would it look like to really put those things together? Again, I don't know. We've got quite a few folks on the phone still, so I don't know if there's things that they're already working on. I do see that Elena says it would be awesome to have regular calls or check-ins around race equity within our housing work. And Charlie says, same here, looking forward to putting these thoughts and goals into action, right? So how could you really mirror that or match up that prevention work and that racial equity? I think it could be really, really interesting.
Yeah.
Tina says, how do we get funders to commit/recommit so that they are also looking through this racial equity lens? Deb, you want to answer that?
Thank you, Tina, for that question. I think you bring up a really good point, and I know that there are many funders and communities that are like a lot of the racial equity, and like when I was learning and kind of learning about centering the work and using kind of like the lenses was when I was actually a funder and working in county government. So I know that there are really there are folks that are doing this work in government and funding sectors that are centering it. And I think like Seattle comes to mind, in Oregon, where I was prior to coming to DC. So there are funders that are looking at how to center this work, how to redistribute resources, fund culturally specific organizations robustly so they're able to do the housing work within their organizations, and shifting it from mainstream organizations. So I do think that there are examples out there for sure, and communities that have already made the shift and leading this work. But I do think it takes people having these conversations like we're having, and then having people within funding organizations that have that are aligned with this, and then if they aren't, that like we as advocates and people committed to this work and racial equity within the housing work, like how do we advocate and push those funders to move on this issue?
Well, it's interesting you say that, because again, the three-tier lens really came out of our work with stock administrators. And so, we're now going on our 8th year with the STOP project, or maybe the 7th. I've been at WLCN 8 years, so maybe the 7th year. We actually worked with STOP administrators to help them think about how they could reshape RFPs. We worked with them, doing site visits with them very intensely over these past several years to really help them think about how to shift funds or how to better reach and resource communities of color, three-tier populations, as we call them. So that is work that we've done. So in thinking about ongoing work, we would definitely be happy to partner with any of you all on that, or to work with NNEDV on that.
I'm all for it. Let's do it. Yep.
So one more. Mm-hmm.
Yeah, I think what you're describing is like, you already have the foundation of doing this work with one funding stream, VAWA, and then like how do we transfer this to other streams around in the housing world. And I'm just thinking about the prevention piece too, like how could we are doing some shifts around shifting funding to be prevention focused around keeping people housed before they become homeless. But how do we have more of those resources as well, so people
Right.
don't have to go through the trauma of homelessness.
Right. Absolutely. Absolutely. And we've done it with FIPSA administrators as well. So one of the other things I'm thinking about, in order to do this, we need, so thinking about sort of the what and then also the who in that bigger brainstorming conversation. So if you needed to have guidance or you needed to expand who you're serving, and then what would you need? You know, administrators that would be willing to help you on that. So just thinking about deeper action planning, even from this last question. So there's some things going on here in the chat. So Jean says, hopefully it's about helping everyone open up to a lens of justice. And if you are in a privileged role, you can embrace taking on that work too from your own role. Oh, okay, this was to Angelina. How do you tell the oppressor they are the oppressor and still have them fund your work? You know what? There is a great book out right now called, what is Edgar's book? Are you all familiar with Edgar Villanueva's work? Let's see. Yes. Oh, okay, Angelina, you said you read it? Decolonizing Wealth. So he talks about that, right? So Edgar comes from the world of philanthropy, and he, you know, worked at one of the, or maybe more than one of the most, you know, the largest philanthropist organizations in the country. And he has written this wonderful book about decolonizing wealth and what that could look like. And so, and I have the book, but how to talk to funders about how they can redistribute wealth and all of that. So I would definitely highly recommend Decolonizing Wealth. All right. And also, I think it's in the way, Angelina, I think it's the way you word things too, like Jean was saying, right? Referring them back to, even if they don't believe it, even if they, you know, don't share your, you know, inwardly, if they don't really believe what you believe, even still using Jean's language, you know, it's about helping everyone, and this is what we're all here to do, and so using that language can be helpful as well. Did anybody else have any questions in our last 8 minutes together? So these are some of the resources that WOCN has. So our economic policy and leadership report, gaining ground and breaking through. These were interviews that talk more about domestic and sexual violence, the field, women of color, how they're faring, how they're not faring, et cetera. Information about our Jagged Justice Project. And then here are some race equity tools. Right. And then our report again. This is some of CSHA's resources. And if you want to contact me, there's my info there. Again, happy to answer any last-minute questions. So many familiar names. Thank you, Rebecca. Thank you, Colleen. Thank you, Charlie. Thank you, Hillary. Angelina. Thank you. Thank you, Jean. I know. It's great to be with you, too. I miss chatting. Thank you. Thank you, Emily. Molly. Deb, did you have any closing words?
I just want to say thank you so much, Zoe, for grounding us in our work and holding the space for this racial equity conversation. And I And I see it as the beginning of many more as we center this work in our housing approaches and how we think about it, and how we also work in our organizations on a variety of different ways that we are trying to undo and unlearn racism. And I think it's always great to have these conversations. And I just thank you for your time and your work, and thank you for everybody for joining the conversation. And it's been one of the most active chat boxes, so thank you.
Yes, good stuff, good stuff. Thank you so much.